And welcome back to Fox 10 News at 4. March is Colorectal Cancer Awareness Month, so we're going the extra mile here to make sure you know what symptoms to look out for and also what to do if you're diagnosed. You have Dr. Lee Grimm from USA Health in the studio with some really important information. Thank you for stopping by. And I see you have on blue, and that is for...
That's the color for Colorectal Cancer Awareness Month.
There you go. All right, so I want to start with the basics here. First things first, screening.
Yeah, absolutely. So I think that people ask about what are the symptoms of colorectal cancer, and people don't undergo screening because they feel that they're not having symptoms. Well, the problem with colorectal cancer is it doesn't really cause any symptoms until it's very advanced, and so screening is extremely important. And
just before we came back on here during the commercial break, we were talking about the group that's seeing more diagnoses of colorectal cancer, and that was interesting what you said.
Yeah, so that's correct. So across the board for colorectal cancer as a whole, we're seeing a decreased rate of diagnosis and death from colorectal cancer. In fact, it's fallen from the third most commonly diagnosed cancer now to the fourth. The only age demographic that's still showing an increased incidence of diagnosis of colorectal cancer is those less than 50. The concern with that is that people less than 50 generally are not recommended to have routine screening.
And so as a result, they're tweaking that, I would guess.
They are. So just this past year, the American Cancer Society came out and officially recommended starting screening for colorectal cancer for the general population. That's people without any family history or genetic history of colorectal cancer, to begin screening at 45 years of age as opposed to 50.
You talked about genetics, so I want to touch on that. You can't really do anything with what you're born with. In terms of your risk factors, what can you do?
So in terms of genetics, it's important to know your family history. That's the number one thing. If you have a family history of a first-degree relative, that's a parent, a brother or sister, or a child with a history of colorectal cancer, that puts you at much higher risk for developing colorectal cancer, even if you don't have a genetic mutation causing your increased risk.
And even then, if you get that diagnosis that you have colorectal cancer, there is hope.
Absolutely, and again, it points back to screening. So the purpose of screening is actually not just to diagnose cancer early, but to actually prevent it. So colonoscopy, if you choose colonoscopy as your form of screening, it can actually find a polyp before it's become a cancer, and if it's removed, then you never even get the diagnosis of cancer.
All right, well, a lot of important information here. Certainly appreciate you stopping by to share it with us.
Absolutely.
And we're going to have this posted for you on fox10tv.com. If you want to share it, you can share that information yourself. Just log on to fox10tv.com. We'll be sure to get it posted for you shortly. Thanks again, Doctor.
My pleasure.